5% cut to the monthly allocation means you have $7.3 million less to work with. The department is looking at a reduction in force of 100 employees. It's going to shut down some certain bed spaces and rearrange others. Outline for us what is going to happen to your agency.
Well, first, our agency, starting in July, took a $7 million cut just starting out the fiscal year. Our entire budget's about $300 million. In addition, then, over the last 2 months, we took a total of $1.6 million in reductions, and now this 7.3 comes on top of that. So we're talking about nearly a $16 million cut to mental health and substance abuse services throughout the state, which means Oklahoma families are going to lose access to care, and they're going to be Oklahomans who are going to lose their job.
How does this cut affect the federal money you bring in?
Well, specifically, not only do we have the state dollar loss, but we match our dollars with federal dollars through the Medicaid program and other things. And so when we lose state dollars, we actually lose more than that. So we estimate we're going to lose several $1 million in mental health funding for children from the federal government as well.
How does Oklahoma compare when it comes to the rate of mental illness and how much we spend to treat it?
I think this is one of the most frustrating things for me. We are already funded 46 per capita in the nation for mental illness. We are near the bottom. This is going to make sure we move even lower, which is unfortunate because we were actually gaining ground. And the frightening thing about that is not only are we funded 46 per capita, but we have either first or second highest rates of mental illness depending on which year they do the study. And folks often say, well, why do we have a state with higher mental illness? We are an unhealthy state. We have high rates of heart disease. We have high rates of cancer, diabetes, all these things. It's not a surprise we have high rates of mental illness and addiction. The question is, what are we going to do about it? And what we're doing now is not a wise decision either for Oklahomans in need of services or for the state's budget.
Does this affect the attempt to help treat those with meth addictions?
I think it will affect addiction across the board. So I think we will see a loss of services for methamphetamine addiction, which is really unfortunate given the emphasis Oklahoma's put the last couple of years on this, the support from places like OETA and other folks, the leadership of the First Lady, Kim Henry, working on initiatives like Crystal Darkness, where we've really seen an awareness. We're going to lose access to services. There's going to be an even longer waiting list. And when someone asks for treatment for addiction and you tell them, we'll call you in a few months, you're likely to lose them before that point.
How are you going about shifting the services to help as many Oklahomans as possible?
When we took the first cut in July, there was the loss of $7 million, we really were able to concentrate our efforts and make sure that while services might look different for folks, no one lost access. But with this second round of cuts, when we're now cutting out a total of $16 million, they're actually going to be Oklahomans who are going to lose access to care. And it really frightens me for families out there who are desperately looking for treatment, whether it's for their child or for an adult family member, a brother or a sister. We know that recovery absolutely works when folks have access to services. But when folks don't have access to care, they tend to get more and more ill. Just like if they had asthma and they never got medical care, they get more and more sick until there are devastating consequences.
How soon will the people looking for services, whether in mental health or substance abuse, feel the impact of the cuts?
Just a couple of weeks away for folks when they're going to start seeing a difference in the access to care. And what really frightens me, I think the thing that's most concerning to me, is we continue to hear that the cuts may not be over. Our agency cannot sustain any more cuts. We are already losing services for Oklahoma. Anything deeper, and we are going to have devastating effects for even more families, and you're going to see significant job loss both in the private sector and the public sector. It is not going to be good for the economy, and honestly, it really doesn't make sense. When you cut services like mental health and substance abuse, the state and taxpayers will pay more in the end because folks will now become involved with the criminal justice system. We'll see an increase in kids in the foster care system. You'll see an increase of folks ending up in the emergency room, all of which cost taxpayers more than if we just provided this treatment in the first place. And that's the part that policymakers have really got to consider when they decide whether or not to cut this agency any further. Folks need to start making the distinction about, do they want access to care in their community? Do they want to have access and have a healthy brain? And if so, they need to make their voice heard.